Hi guys, my name is Dr. Rahul Khare. I'm the owner of Innovative Express Care and also an emergency physician. I just wanted to do a quick Facebook Live to talk to you about what's going on the front lines here at Innovative Express Care. Lots going on. COVID-19 is still affecting us. We are not even close to being at the peak here in Chicago, especially on the north side of this area. We are still in the in the beginning stages, unfortunately. And I just want to talk about what we're seeing. So far, Innovative Express Care has diagnosed 51 patients with COVID-19. We use PCR standard testing through a lab, and we're using swabs, either the nose or the throat, depending on what supplies we have. The good news is we've seen no deaths so far during all of our follow-ups. Patients are doing really well, and we are grateful for that. We did have one patient who was in his 70s have to be intubated, but I heard in the last couple days he's been extubated, meaning the tube is out of his lungs, and he is improving. So that's great news. But to be honest, what we're realizing is how this virus is actually very dangerous for people who are elderly and people who are young that have comorbid conditions such as asthma, rheumatoid arthritis, Sjogren's, like all these autoimmune disorders, especially lupus, anything that affects the lungs. You have to be extremely careful with these patients. So I want to just make that point. And the theory is it's not the virus that's getting patients that are replicating and causing havoc. It's actually our immune response to the virus. There's significant response from adults, and the older you are, the more response we feel that you're getting. And this is an autoimmune response. So when it sees a regular virus, it may, do a moderate response. You might have a runny nose, a little bit of cough. With COVID-19, it's like it's attacking 20 viruses, and it's really attacking the lung parenchyma, the lung lining, and it's causing congestion. When inflammation occurs in the lungs, it also causes significant leakage of fluid. When that leakage of fluid goes where the blood-air barrier, kind of blood-air exchange happens, it doesn't exchange as well. So oxygenation kind of decreases. You can't get oxygen, hence the chest tightness, increased shortness of breath. Those are the things we worry about. So it's really important to know the signs of if you have COVID-19, and that's shortness of breath while you're talking, shortness of breath while you're sitting. Those are things you have to really call your doctor about, and those are the things that I would expect you to go to the emergency department for. So a little bit on the background of how COVID-19 is affecting humans in general, and it's a very scary process. There's been good talk about hydrochloroquine, which is a medication that decreases some kind of immune response. That's the theory on how it works. There was anecdotal, very small study. We're talking 20, 26 patients in each arm of the study that showed that there was good results in decreasing the amount of viral load in patients who were admitted who had COVID-19. Here's the deal. Do not start buying the stuff, getting it from others. It is not the way it works. The small study was done on patients who were admitted to the hospital. Let's not use it. There's nothing that says that it will decrease the chances of getting the virus. And in fact, it could actually hurt you because we haven't studied that. But it's really exciting that the FDA is doing an emergency use authorization for that medication and studying it. And they're using it in New York, and we're going to find out more. Second thing is Abbott has come out with a 15-minute or so rapid test. We've used these actually machines. It's a DNA amplification. A lot of urgent cares have used this for strep throat and influenza. We used to have like 5 of these machines lined up during flu season. So it works really well. And they tout that if you have COVID-19, you're actually going to get a positive within 6 minutes. So I've used these machines. They work really well. let's see how it goes. Again, this was passed under FDA is allowing this through the emergency use authorization that they are granted it. You know, we have to look at these tests in real life, but it's really great news. So far, I talked to the Abbott reps and Abbott administration, and they basically told me that the hospitals are going to get it first, as well as some of the places that are being hit hard with COVID-19, which includes New York and some parts of California. So hopefully we'll get that in the next week or so, maybe earlier. Innovative will definitely be trying to get it as well to give to our patients. What else can I talk to you about? There's definitely, how do you get tested? People are asking me this all the time. Well, first and foremost, you have to really get a telemedicine screening before we'll test you. The reason is that a lot of people have asymptomatic, they're asymptomatic, no signs whatsoever. They're just afraid of it. They have really big anxiety. This is not for you. Right now, we don't have enough tests to do asymptomatic patients. It's just the truth. So we really want to screen these patients out and really talk to them for 10 minutes to see what's going on, what their symptoms are. So if you have a fever or you have symptoms, a viral symptom, then you'll be able to get past the telemedicine. But telemedicine is really important because we've gotten a lot of people just kind of walking in, which exposes you to COVID-19 because we're a testing area, but it also isn't fair as well. So we want you to do the telemedicine, and you can find out more going to innovativeexpresscare.com or just Google us and click on the COVID-19 link, and you'll get to the COVID-19 website that we've set up. Now, after you do their telemedicine, the one thing I want to tell you, first responders and healthcare workers, you can bypass the telemedicine. That's the one exception. Or if you have a note from your doctor that's saying the doctor wants you to get tested, that they've talked to you and or you've done some kind of provider has given you something that says they have talked to you, then you're able to bypass the telemedicine. Once you bypass the telemedicine, or once you get approved through telemedicine, or if you're a first responder or have a note from your doctor, you can access our tent, which is up. We were just featured in Fox 32 this morning, live around 9 o'clock. And basically, you park in our parking lot. You do have to come outside. We give you a mask and you make sure you're registered properly. We take insurance. We do have a self-pay option too. But that is to bill your insurance for the test. The lab is going to bill them for that. So that's important. When you go back into your car, and at that point, the provider and the medical assistant will come to you, and we will talk to you more about your history. We already have the telemedicine or the doctor's note you can give us. And we'll then swab you for COVID-19 and if we think it's necessary, influenza. We've had about 5 today. We had 5 flu cases, and perhaps even strep throat, because a lot of people have burning pain in their throat and they have high fevers, and lo and behold, it's not COVID-19, it's actually strep. So we examine you, we listen to your lungs, and then we let you go. So I will, we are doing this from around 10 a.m. to around 4 p.m. every day. And we hope to see patients who feel symptomatic, and we can help test them. So that's how our testing system works. We are testing around 50 patients a day. And so it's up and going. The wait is less than 10 minutes usually. People get to wait in their cars, which they like. And it's pretty much get in and get out within 10-15 minutes. So anyway, please let me know if you have any questions. I will get you on the next Facebook Live. I love doing these. It's been a while, but it's Happy Doctors Day, so any doctors out there, this is a day to remember, that's for sure. But I want to thank all the patients who have come to Innovative, and all the providers really who are really helping helping treat the Chicago North Side and Chicago in general. Our staff is working really hard, working overtime, and really just love doing what they're doing. So I'm very very appreciative of them. Please let me know if there's any more questions, but you guys have a good night and really be safe. The last thing I'm going to end on is something that I've been thinking a lot about from the scientific point of view. I really believe in the CDC. I really believe in our government for leading us, and I'm not going to go into politics here. Don't worry. But there are things that the CDC does for population health, and they have to do that to help everyone that they can. But there's one thing that I've been reading a lot about that I wanna just introduce to you guys, and that's the concept of wearing masks when you're not in isolation. I'm a huge advocate for this. The science has always shown that masks can decrease the amount of viral load that's emitted from patients with flu and other viruses that are increased respiratory, that are from the respiratory tract. COVID-19 we know comes from the respiratory tract. It doesn't come from the air we give off, it doesn't come from our skin, it doesn't come from anything but our respiratory tract. What we breathe in, breathe out. When we cough, those kind of things. And so we've done our first step in Chicago, which I think is amazing, of the stay-at-home legislature, that is shelter-at-home legislature that they've done, and they're doing this across the United States. So I'm very proud of the places that have done it. But we need to take it one step further, and that when you're outside of your home, when you're out going grocery shopping, at the gas station, interacting with people, it's probably a good idea to put a mask on. And I'm not saying that out of fear or anything else, but it decreases, even if you don't have symptoms. Remember, we're contagious up to 5 days prior to having our first symptom. So it could even be longer. So you don't even know you're giving it to the gas station attendant or the grocery person that's bagging you have no idea. So what if all of us put on a mask to decrease that amount? We should be washing our hands every hour for sure, or using hand sanitizer every hour while out in public. Why not cover your face? And I don't think that's too much to ask. It's something I want to bring up with you guys, something I feel real passionate about. And the reason why I think it should be mandated through the government is because it is so important to decrease the curve to bend the curve, and this is one second way to do after isolating yourself. But secondly, since we have people that are essential, police officers, firemen, doctors, nurses, people in construction, I mean, they're still interacting with people. If we can decrease those, the contagiousness of them, I think it's really important. So it's something to think about. It's to protect you, but it's also to protect others, is to use a mask when you're outside. It's not forever. I think a month, maybe 2, but I think it's something to think about. It's something you're going to hear me talk more about, and it's masks for all. And it's something you should look up as well. But there's really great studies coming out, and I want to introduce it to you guys because you're going to hear a lot more about masks for everyone when you're outside of isolation. So I'll leave it at that. You guys have any questions, please get on our Facebook page, and I will try to answer them next time. All right, guys, have a good day.